4 minutes and 20 seconds from now, you'll not only understand hemoglobin, but will be able to cure the most common blood disease in the world. And as a bonus, I'm going to give you my iron deficiency reversal guide and links to my favorite supplements. Hey, I'm Dr. Tom Scheck-Snyder, and I want to help you understand your labs and optimize your health. I do that two ways, through the Lab Stories podcast and through these short topical videos that cram the most amount of educational material in the shortest time possible so you can literally understand your labs and optimize your health. Because when your health is optimized, you can do anything. If you're cool with that, let's go. So what is hemoglobin? Hemoglobin is the main protein in red blood cells, and its job is to carry oxygen. Let's look at the structure of hemoglobin to see exactly how that happens. Hemoglobin has 3 ingredients: heme, globins, and iron. Heme is a pigmented molecule that gives blood its red color. In the center of each heme is an iron atom, and each heme-iron combo is linked to a globin chain. The globin chains are peptides, which are short-length proteins. As you can see, there are 4 of each of these heme-iron-globin combinations, making hemoglobin a tetrameric protein. The globin chains are further named alpha and beta, which we'll skip over in this episode, but are important in diseases like sickle cell anemia and thalassemias, which are mutations in those peptides. Now, the iron atom is what directly binds oxygen to transport it through the blood from the lungs to the tissues. Normal hemoglobin levels are between 13 to 18 grams per deciliter in men and 12 to 15 grams per deciliter in women. If your hemoglobin is below those levels, you have anemia. The word anemia literally means without blood or low blood. Anemia is the most common blood disorder in the world, and about 50% of the time it's caused by iron deficiency. In other words, the most common cause of low hemoglobin is low iron. How do you get low iron? From bleeding, usually heavy menstrual bleeding. In fact, iron deficiency anemia predominantly affects women and is the 4th leading cause of disability amongst women worldwide. So it goes like this. Heavy menstrual bleeding over time reduces your body's iron stores to the point where there's not enough iron to make enough full-size red blood cells. This is the beginning of anemia. The bone marrow still makes red blood cells, but it can't make as many, and the ones it does make are smaller and don't carry as much oxygen as normal-sized ones. Low iron equals low hemoglobin equals low oxygen carrying capacity equals symptoms of anemia, which are defined by whatever organ doesn't get enough oxygen. If it's the brain, dizziness. If it's the muscles, weakness. But the global symptoms are fatigue, shortness of breath, and decreased exercise tolerance. The signs are pale skin and eyes, since the blood isn't as red as it should be. Before we get to the hemoglobin restoration plan, pretend the red subscribe button will infuse you with hemoglobin by hitting it. So go ahead and subscribe. Now here are the 3 steps you can take to make your iron and hemoglobin levels normal again. Number 1, stop the bleeding. This is an individualized discussion you should have with your doctor that I would summarize with this statement: optimize your health. Heavy menstrual bleeding is often the end result of hormonal imbalances triggered by metabolic disease. I don't want to oversimplify it here, but I have a free weight loss checklist linked in the description that'll help you set your metabolic health straight. Number 2, eat more iron. Include heme and non-heme sources of iron. Heme is in hemoglobin, but is also contained in myoglobin, which is the main protein in muscle or meat. Since we know that heme is red colored, red meat contains the most heme. So eat red meat. If you don't like to eat meat, you can take heme iron supplements like Feramax. You should also eat non-heme iron sources, and that's contained in vegetables, legumes, nuts, seeds, and fortified grains. I don't recommend fortified stuff usually, but it's there if you need it. And the reason you should eat heme and non-heme iron is that they're absorbed differently. Combine the different forms of absorption and use it to your advantage. Number 3 is take a supplement. Most supplements are non-heme iron, and there are a bunch of good ones out there. The 2 keys to success here, though, are take it long enough to actually replete your iron stores, which can be several months, and take it as often as possible without experiencing side effects that'll make you quit. My favorite iron supplements and the iron deficiency guide are linked in the description. You can download it at any time so you can have it for reference. So what should you do next? If you're still uncertain if you have iron deficiency as the cause of your anemia, listen to Lab Stories episode 2, where I go into great detail about MCV, ferritin, transferrin, hepcidin, and anemia of chronic disease, or check out my video on mean corpuscular volume, which is the next best test to do to determine the cause of low hemoglobin. Here's to understanding your labs and optimizing your health.